Hello, Mr. McKnight. My name is Darlene Folden, and I'd like to take a few minutes of your time to tell you my speech, which is called Uterus Cancer. I went in for my annual checkup at the doctor's office, and I found out that after all my tests had came back, that I was going to have a partial hysterectomy. At this appointment, my doctor told me what I had to look forward to and what was going to be done. My doctor explained that they were only going to take out my uterus and not my ovaries or my cervix. The reason that it was going to be a partial hysterectomy instead of a full hysterectomy was because of my age. If I was older, like in my 40s, then they would have taken it all. But since I was only 25 at the time, and at that young age, they would rather not have people go through hormone shots and do hormone medications. Some kind of other treatments that they have. My doctor told me that I would have to register at the outpatients, and I would only have to spend one day there. After I got done talking to my doctor, I went home so that I can make arrangements for someone to take care of my children while I went into the hospital for the surgery. My cousin agreed to take the kids, and she agreed to make sure that my son, my oldest son, Ryan, got to school. So the date came for me to go in for the surgery, and I gave my kids a hug and a kiss, and I told them that I loved them, and I'd be back in a day or so. My friend was there who drove me to the hospital, and when I got to the hospital I had to sign in, and a little while, 15-20 minutes later, a nurse came out and she showed me to the room where I was going to be staying, and she brought in a gown, and I changed and I put the gown on, and then when I finished she came back in and she took my vitals, she took my blood pressure, she checked my temperature, and she checked my heart rate to make sure everything was okay, because if I had a temperature I would not be able to have the operation, because it is a little dangerous if you have a high temperature, because it could cause infection and there could be problems. So, but everything was okay, so we were on to that. And then another nurse came in and she put an IV in my arm so that in case when I was on the operating table, if I needed any kind of medications or anything like that, it would be easier to put it through an IV, which I found out makes a lot of sense. Then after that, they checked everything, they did everything, and then the anesthesiologist came in and asked me if I had any questions, and of course I didn't at the time, because they covered everything pretty thoroughly. So then I signed the release form, and the doctor put a face mask over my face and asked me to count backwards from 10. So I started to proceed to count back. I think maybe I made it to 4 or 5, not really sure. I could be off, but not really sure. So as I was, so then I'm sleeping now, and then they wheel my bed into the operating room where the doctor puts a clamp, or I can't remember the technical name, but it's a device that opens the cervix, the vagina, so that you can see clearly into the cervix area and into the reproductive area. He also put in a microlight, which he put next to my inner thigh so that way he could see it even a little clearer. And then he made an incision around my cervix so that he could access my uterus easier. And then he started to detach the blood vessels and the connective tissue from the uterus that was connected to the walls. And then he took out the uterus through the vaginal canal, the cervix and the vaginal canal, so that I wouldn't have to have a scar on the outside. So it was all on the inside. So that was great for me. When he took out the uterus, he made sure that after that he made sure all the blood vessels and the connective tissues and all that were not bleeding. And he looked around at the ovaries and he checked my cervix, made sure that was okay. There were no fibroids or cysts or anything like that attached to the ovaries, so everything was okay. And he checked one last time to make sure everything else looked good and there was no more bleeding. Then he sewed up the incision, and then he checked again one last time to make sure that the incision was good, everything was good, there was no bleeding, the clotting was fine, there were no complications. Then they wheeled me back into my room, and I woke up several hours later in a lot of pain, of course. They gave me some painkillers, which sort of took a little bit of the edge off, but it really was very painful. I spent the night, and then I spent the next morning and the afternoon. I had to use the bathroom to make sure everything was okay. Then after that, everything was alright. They signed my papers, and I got to go home that afternoon. I went back to see my doctor several weeks later, and just to make sure everything was healing okay. There were no complications, and I was healing very good. He said that my case was actually pretty good because my uterus, my cervix area and everything healed up a lot quicker than most women, so that was a plus. And he double checked everything else, made sure that the scars didn't overlap and make any kind of cancerous cells or anything like that may be worrying, because I've had a lot of procedures done before where every time they cut, they make it worse. But this time it was really great because it's been 3 years since my surgery, and my health has been good as far as that's concerned. And I haven't had any cancer cells since, so that is so wonderful. And of course I can't have any more kids, but I have 3, and that's great. So I'm not, 3 is enough, I think, for one person anyway. It's good enough for me, so that's great. But no complications, everything's healed up fine. There's a little scarring, but nothing too bad. But other than that, everything is wonderful. And that is my speech. And so I hope you liked it, and I hope I did okay. I was a little nervous, but so you have a good weekend. Thank you.